So the goals of the social prescribing project are to help people to improve their health and well-being, to find out what support is out there. There's some really good groups and services out there that people can access for first-class support to improve their health. And often when people go to these groups and services, they often become volunteers in return. They get so much out of it. It builds up their confidence and their skills quite often that they become a volunteer for maybe not that group, but maybe other groups as well. And we've had a real success with all the volunteers and volunteering hours that we've built up. I think it's something like 4,000 hours now over the last just over 12 months. So it's been a real success in that respect. So my name's Jan Fotheringham. I'm a social prescribing support worker for Copeland Borough Council. The issues that people seek out help for in our groups are things like digital awareness, financial hardship, welfare and benefits, loneliness and isolation, housing and homelessness, low-level mental health and physical health. So all the groups and services on our directory cover those issues, so it's quite a comprehensive range of support out there. The role is about helping people to improve their health and well-being without necessarily going to the doctors and seeking help there for what could often be social problems. And often the GPs are too stretched and they can't handle those sorts of issues. So they may well have gone to the doctors with a medical problem, but they also often have social problems as well, which is what social prescribing aims to address. And how we address that is that people may go to a doctor and they may say, I've got an issue, for example, with depression because I've lost my partner, or I've been divorced or something along those lines, and I'm very lonely. So we would connect that person up with an appropriate group and service in the community to help with that issue. Well, our primary aim at Copeland is to support all our community groups and services, because when the NHS social prescribers refer patients onto the groups, there isn't necessarily any funding that goes with that patient. So we get quite concerned that the groups might get oversubscribed and they probably need help in sustaining the increased patient referrals that they get. So we're there just to support them. And also another part of what we do is to look at gaps in the area and help groups to maybe even come together to fill that gap. An example of that we're working on at the moment is we've identified that there's a lack of gambling support certainly in West Cumbria, I think probably Cumbria as a whole. So we've contacted various organisations who are now being pulled together, and they're creating a really good source of support for gambling issues.
The funding from Copeland Community Fund has been an integral part of the delivery for social prescribing. Without the funding, we wouldn't have been able to support so many residents in Copeland. It's been phenomenal, the work that we've been doing with our social prescribing team, and many people have come forward who wouldn't have sought support because they felt that they were listened to and being able to come to people in a safe manner. Hi, my name's Emma Williamson and I'm the Social Inclusion and Community Resilience Team Leader for Copeland Borough Council, and I lead on the social prescribing programme. So the money that we received from Copeland Community Fund was to pay for 2 staff. Those staff have been absolutely fantastic in not just supporting the community, but also helping myself and the team at Copeland lead the COVID response. So very early on, when social prescribing first started, 6 weeks later we were in a global pandemic, and the social prescribing team were supporting the county council to deliver the hub. They were out in the community recruiting volunteers. They supported the 32 COVID groups that were created by the communities to support the delivery of food and resources to the community. The social prescribing programme during COVID was a lifeline for many. So the future of social prescribing for me is to have the possibility of creating a digital app. So at the moment our social prescribing directory is a manual directory, which takes a lot of time and manpower to edit, upload new groups and services, pull stats down off there to give to Copeland Community Fund and to pull that off the groups and services. We envisage the future of having a digital app where residents themselves can go on and make their own referrals, where groups and services can be registered on there and pull off their own data. But what's really important as well is we'll be able to oversee the app and we'll be able to identify trends. So for example, with gambling support, if we see that there's 2 groups set up to support people and those groups are getting oversubscribed, we can step in and support the groups and services to look at more funding, to deliver more services. And likewise, if we see a trend where there's a gap, where people are asking for support through the app for a group, for example, something like a tea and chat, that's came up in previous months on gap analysis, we can then work with the groups and services to identify a venue, funding to deliver those activities. But the future for me as well is to not need a full social prescribing team, because what we would like to see is peer support. So what we would like to see is people coming forward who've been given support through social prescribing, who've accessed the services and are ready and willing to volunteer, and pair them up with people who might be a bit more nervous about using the services. So I think peer support for me is a big part of social prescribing and the future, where we don't have to rely on so much funding. We're a bit more sustainable and we're also upskilling and using the expertise and experiences of service users.